Okay, it's 2:25, and we're going next to connecting the dots to help grow immersive technology within a healthcare system with Keith Widmeier from Children's Hospital of Philadelphia.
All right. Hello, everybody. Is this what I'm using to move forward? Okay, sorry. Hi, everybody. Again, my name's Keith Widmeier. I am a simulation immersive technology educator, which sounds like a really cool title. Not exactly sure what it does. It's actually been a great journey. I started out at Children's Hospital of Philadelphia about 4 years ago, and I started out as a simulation educator, which means I used a variety of simulation techniques and equipment to help teach physicians, nurses, respiratory therapists, and any other person in the healthcare team how to move forward and how to either, critically think or how to work through systems within a new workflow. Lots of really cool opportunities. And we started going into immersive technology, VR, AR, XR, and that's kind of where this journey started. So I love this picture of me, by the way, and I'll explain that here in a second. But the reason I put this lecture together is because there's a lot of people who've done phenomenal presentations on different VR, AR, XR software, tools, techniques that they're using within healthcare, but there's not a lot of information on how to connect, how to actually deploy it within a healthcare system. And honestly, it's not easy. I've been listening to some of the tracks in the enterprise, or some of the lectures in the enterprise track, in the training collaboration track, and in the healthcare track, and they all intertwine. And that's where this came in. This picture over here is actually, I'm trying at home to onboard one of our VR headsets with a QR code, and I thought it would be helpful. It actually worked out pretty well to put it on my big screen to try and have the QR code reader go through that way. So when we were trying to onboard it onto the MDM, that's where that came in, and Slimer's just hanging out in the top corner. What the presentation's going to go over is kind of discussing what available resources are already in a healthcare system, talking about hardware and software needs, talking about connecting the right people, connecting the ideas to the people who might be able to move things forward, and space requirements. Before we move forward in this slide, can you raise your hand if you work in a healthcare setting? Great. And then raise your hand if you are working for a software or hardware manufacturer trying to enter into or already in that space. Great. Just want to make sure I get a pulse of the audience as we go through this discussion. So one of the first things we did on our journey was try and get a lay of the land. I'm sure CHOP is unique. I'm sure nobody else's healthcare system was in the same boat where so many different people were doing VR, AR, or XR, and nobody was talking about it. I'm sure that was just an us thing, right? Nobody else. If you talk to any healthcare system, anybody that's starting down this journey, they quickly realize this. So that was really one of the first things as we started in this journey was, what resources do we have? What VR headsets? What AR headsets? What software? What are people doing? Trying to track that down. And unfortunately, healthcare systems are an enterprise, and there are silos, and you really do need to try and connect those people together. So identifying the key stakeholders. Whoever you're going to be working with is crucial. Whoever your clinical stakeholders are, information systems, IT, and This is always a sticking point, and I know we have a healthy mix of clinical and IT people here, so it's always a sticking point because people will come in, hey, I have this idea, I want to do VR, I want to use this software. Okay, great, it's going to take a while. Forget you, I'm just going to go ahead and go on the guest network and I'm going to do it. That's fine, people do that a lot, but you're losing resources. That department's there to help you, but it is a process. It is not a quick, it's not a quick journey. It does take a while to go through it. But once somebody pushes through, goes all the way to the end, they have now opened the floodgates. So everybody else who is using the headsets that you've made sure are approved, using any of that software that's already approved, can now jump on. And that's really a way where now you're not concerned with bandwidth issues on your guest network. Are you going to get kicked off? Are you going to lose signal? Now you have the support of that team. So I would implore anybody, incorporate them in early. Education and research teams, making sure you get those teams involved. There's a plethora of educational opportunities. I know in one of the previous lectures, somebody was asking about patient-family education. There's a wealth of possibilities for patient and family education with this technology. There's also a wealth of possibility for staff education with this technology. And research. Research within education and training, absolutely, why not? But there's also other things that you can evaluate. If you were in the previous lecture and they were talking about gaze, where people are looking, you can go ahead and evaluate that in training settings where you can push some of those limits. You can modify patients' vital signs and get those extremes to see, are your participants task saturated? Are they looking where they should be looking? So there's lots of possibilities, but getting them involved and getting them included. So immersive technology use at CHOP, Children's Hospital of Philadelphia. We have it in a wide variety of areas. Our cardiology team utilizes it for patient surgical planning, where they'll go through, they'll take a CT or an MRI, they'll convert it over, 3D asset, and they'll go ahead and visualize it in VR. And they'll plan what that surgery looks like, what is the path they're taking. HR and digital health. Our HR and digital health teams were actually some early adopters. They had Quest 1s as they were looking to go through this. But, and they have great work. But again, they were siloed, just like all of these teams were. Simulation, that was me. We had a variety of VR headsets that we were able to utilize. We started out with tethered, 6 tethered headsets where we were able to, and trying to get an Alienware on a hospital network, like trying to get that past your, accounting, saying, yes, I need this gaming laptop, but I promise you, I'm not gaming on it. It is a process, but you do have to explain it. So we had a variety of things as well. Our NICU, we were using it for training evacuations, NICU evacuations. Injury prevention, our injury prevention team was utilizing it for youth driver education. And our child life team utilizes it for distraction therapy. We have a variety of kids who might be there for days, weeks, months. So this just gives them another avenue to be immersed to kind of get out of that environment for a little bit. There's also, what's not up here, our anesthesia team. They're heavy users. Our anesthesia team utilizes it for pain therapy to distraction therapy. So we have a wide variety of people who are using it at CHOP. And I love this picture. It cracks me up every time I look at it. But the thing is, without connecting everybody, without letting everybody else know, you don't know what those resources are. Equipment. So what equipment do you get? What equipment is going to meet your needs? This varies. Absolutely. And it's probably one of the biggest struggles within a healthcare setting, an enterprise setting, because you might have software that works on one system that doesn't work on another. But it is difficult, I can say, from a healthcare system perspective, when you don't have a system that works on multiple platforms, because it can potentially cut off some of those users or cut off some of those capabilities. So that's a really important thing for us within that setting. I know I've had fears of, especially as things go more in the clinical setting, we have something that is on a specific headset and then we have to stop using it because our IT department says there's a security concern. But then not having a headset that we can transition to. That's a big fear. Not just me, several others within our enterprise have had that discussion. Or there's supply chain issues. So needing to be able to move to different devices is crucial. It's good to get an inventory of what resources you have. I can tell you one of the things that we are currently still struggling with is how to track it all. Like, do we use tiles? Do we use air tags? What is the process for tracking them? We do have everything on MDMs that's standalone, but the actual asset, where is it, has become an issue. So we are working through that. Future-proofing your technology is a wonderful concept that would be amazing if we could do. But we can only go with the pace of our technology. I would counter that with one of the bigger concerns that we had from our leadership getting into this was, why are you getting those headsets? Won't they be obsolete in 2 years? And one thing that I always emphasized was that you have so many years, I'm going to say it's usually like 5 or 7, after they decommission that device, where it will still be supported, which is a reasonable, viable lifespan for a piece of equipment. So I do think that's a powerful argument when you are discussing this with leadership, that it is okay to go ahead and just find a device, because there's never going to be one that's perfect. Technology is constantly moving. And then, what does the system need to make this accessible? That was probably the biggest challenge as we were going through, was how do we get this accessible within our enterprise system? I've talked to many different people from across the country in different healthcare systems about how they get it on their network. More often, they're on a guest network, or they're on a hotspot, or some other workaround. There are some people that have like a router in their VR lab where they can go ahead and access it in that specific space. We didn't want that because our entire VR setup within the Sim Center is mobile. So we go to nurses units, or we'll go to physician workrooms, or to unoccupied patient rooms when they exist. We go to conference rooms, wherever we can to get this set up for people. But we need access. So we actually worked with our IT department to get all of those headsets on our MDM so that they can be on our network, so we don't go into those struggles with having to connect to a guest network and not have enough bandwidth to have more than 1, maybe 2 headsets on. I think anybody who was an early adopter in this technology struggled with this. What software do you get? Where do you go? Do we want to build our own system in-house? Sure, why not? It's the dream. Except the cost that goes with it, and the time that goes with it, and the ability to maintain it. It is an incredibly difficult thing to do. If you have the resources, by all means, that's fantastic. But as we're seeing other systems come up where there's ability for us to develop contents, whether it's a WYSIWYG that we are going through and dropping models in and trying to add actions and move along. Will that meet our needs? That's an important decision, trying to figure out, what is it that we need within our enterprise? What's the frequency of your sessions? That's another big thing. So there are some vendors on the market where if you're doing a synchronous session, you have essentially one space. Great, it works really well, except if you wanted to run 2 simulations at once. You can't have 2 different ones because you'd be sharing the audio. It'd be like doing them in the same conference room. I think of it like reserving a conference room. So having the ability to run multiple synchronous sessions may be important to you, depending on what you're trying to do. We've decided that we want to be able to run synchronous sessions, but we also want to be able to run asynchronous sessions. We want people to have the ability to do training on their own, and honestly, just-in-time training. So one of the examples that I think about is you have a nurse that's in our PICU, and they have a patient, they get trained on external ventricular drains for patients with head injuries to pull fluid out. They get this training initially, but if it's been 3 months since they've had a patient with that, it's nice to have a refresher. And having the ability to get a headset or use your phone and go through in a 3-dimensional experience in that room of how to set that up right before that patient comes, think about how much more beneficial that is than looking at this 2D piece of paper job aid, which is all we've had prior to this. So having the ability to go through and actually look at this before you go into that experience is incredibly helpful. And then trying to figure out what hardware and support do you have available. So when we're thinking about headsets in particular, one of the things that we often have to consider is what support are we going to need to provide? My dream is to have them in each nursing unit, each physician workroom, each workroom around the hospital where there's downtime, somebody wants to put a headset on, jump in at their leisure. That's like the pipe dream. I can't wait for that to happen. But unfortunately, where we're at right now is we have to set it up for them. We have to set up the space. We have to go through, clean it off, and then hand it over to them so that they can jump into the experience. And then we have to put them through a training to get them acclimated to that experience. We'll get there. I truly believe we will, but it's important to remember where you're at now within your system. One of the things for connecting everybody that we did was we made a CHOP XR work group. The idea was to identify resources. So we had a team and a channel that people can go to where they can see what hardware is available, what software is available, what projects are available. We meet quarterly just to share different things. People can bring up concerns about projects that they're having. One of the things that one thing that's been a struggle that we've been able to kind of help with this work group, Steam. I know, I'm sure you all are shocked that a hospital IT department would be worried about having Steam on their system. But it was necessary for some of the software that we were running because it only ran with Steam. So we did work with our IT departments to help those clients have access, even if it was on their specific system. One example I could think of, they had a dedicated VR lab with a Vive Pro, and that port was able to have access to Steam. But they've been dealing with this for months beforehand, and without getting into this group and without having that discussion, it's just been going on to the guest network. And then collaborating, bringing those different ideas together and trying to celebrate some of those successes, trying to get what are the tools that you now have available that you can share. So I'm over on the East Coast. Space is definitely a commodity. And like I said, we wanted our space to be mobile. We wanted to be able to go and set up a VR space or an AR space. We wanted to be able to set these spaces up wherever our end users were. Because we can't have our nurses, our docs, our respiratory therapists, our healthcare team having to come across the street down, halfway across campus to another building and leaving clinical care for that long. So we need to be accessible to them. At the same time, what are the things that we need in order to create a space for them? Well, we obviously need a space to have guardians, unless it is a seated experience. Power depends if we are on a tethered system or not. The ability to move. This was something that came up. It was interesting. One of the platforms we had the ability to teleport to different areas. Another platform we didn't have the ability to teleport. So you had to have at least a 12 by 12 area. That's an important consideration if you're trying to set up an experience for people. You need to make sure that you know this software requires a 12 by 12 area, or else you will be trying to defibrillate somebody and you can't quite reach the defibrillator because it's outside of the guardian and you can't quite get there. And it's frustrating. Equipment security, tracking it, trying to make sure that it's all accounted for. And that's where your MDMs really come in handy. If anything does happen, the idea is that it becomes just a $500 paperweight, $500,000, $2,000. Storage, how do we store and move it? We want all of our stuff to be charged. If we have any backup batteries, we want our backup batteries to be charged and ready to go. And then we need to be able to move it. And another thing that we do utilize UV light boxes for decontaminating between users. So we also need to make sure we're bringing those with us. And then how many head-mounted displays do we want to have set up? This one over here, this room, we were actually able to get 5. And if you see how the tape is like dashed out around, we had to figure out the guardian that was just enough where they wouldn't interact with each other, but we could fit into that space. So they were oddly shaped at certain points. But here we're in a conference room. This was on a phone while somebody else was on a headset. So we were doing a synchronous experience going through where they were able to be in there together, but on different pieces of equipment and having that cross-platform technology. This is in a sim room right here. We have a sim room in our PICU. This one is over in a nurse's station. Like I said, we actually had a nurse's station that wasn't being utilized at the moment. That is a classroom, and then that is a training room, and that is our new sim space. So the idea being we can go wherever we need to. Sometimes you have to get creative with it, but you want to make sure it is accessible, and that's really a big key. All right. Anybody have any questions? In case you don't, I put some up there. My favorite one's in the bottom right over here.
If you have questions, please come up to the mic.
Hi, one of the questions one of the statements you made was that your board was really interested in that product lifecycle past the 2-year mark when new devices would come out. I recognize that would be super important for kids, right? If they have this immersive experience, you can have a shelf life for 7 years, no problem. What about on the training side, though? I would see that the window would almost be more important in making the most up-to-date devices. Was there discussions about that? And then also, are you often replacing the interfaces, head straps, back pads between different devices outside of that window?
Yeah, great question. So just to answer both of them, it was a big discussion, and I can tell you early on, there were some mistakes that were made. Going through, we were working with a private developer who built our software, and they were encouraging us to go with a specific product that actually shortly after we got the system live went completely dark. Fortunately, we didn't go with that product, but then we did go with another headset that did end up getting retired within a year or so, the Rift S, because the Quest 2 was coming out. But because we were able to utilize the Quest 2s as replacements for them, it really wasn't much of an issue. Speaking to the replacement pieces, we do have budgeted disposables for not just the straps and everything, but also for batteries, different pieces along those lines, cases, zippers, all those things. Absolutely.
In 40 years, what will make people nostalgic?
Great question, right? I don't know. I kind of look back and think about some of the things that are already making me nostalgic, but love to hear anybody's ideas.
Hi, Keith. So first of all, for me, hearing your experience is really powerful because I'm from the developers team. I'm not a developer myself, but how would you say from someone who, I have a third option there, not only in-house or buy something that is scanned, we are offering collaboration. So the best way to build something is to get to know your needs and then build something together. And in that matter, thinking about that, what would be your recommendations when we approach, because we are now collaborating with 2 hospitals and we usually don't have all the control about all what you present here. What would be your recommendations and what is the best entry point for any hospital like Children's Hospital of Philadelphia?
Thank you. Great question. I can tell you getting the IT department in early is huge. And then there was expectations for or for information that we didn't have, and then there were some that we did. I can tell you, we reached out to some of the vendors we were working with Education XR. We were able to get their flow of how data went through, and then SimX, same thing, how data went through, how data came back and forth, and how it worked within the system. But one of the things that we needed was a end-to-end flow diagram from setting our headsets up, so whichever headsets we were using, all the way through the experience. And if there was a moderator, computer, or anything else, how that would interact and where any of that data gets stored. So having that information, I would say, is absolutely critical for that onboarding experience. Most hospitals will have some sort of security surveys that they go through, but being able to provide that documentation up front will drastically reduce the amount of time.
And for the departments, and how to scale it up from the entry level?
Yeah, as far as scaling it, one of the biggest things I'd say is I would go back to my roots within simulation. We have to have the ability to modify it in the moment, because that's been a big struggle, where there's been a case made that is for physicians, but it's also applicable for nurses or RTs. But if they're getting feedback for a physician, but they're managing it as a nurse or an RT, it does become difficult. So I would say being able to make those adjustments in the moment is crucial, just like we would if we were using one of our high-fidelity simulators like SimMan or Gamard's HAL or any of those. Absolutely.
Hi, it's very interesting to see the different types of end users you're using these devices on and the different departments. I'm curious about budgeting in terms of where does the budget come from? I see is it coming from training? Is it operations? Is there patient-related? And you mentioned HR and digital health as well. How do you budget for all these different end users using this type of device?
Thank you. Great question. I can tell you we are still in process. Initial funding, the initial startups did tend to come from the departments individually. Some received grant funding. I can tell you our child life team for oncology, somebody came in and they donated, they just here are 12, Quest 2s, for children with cancer, absolutely. But there's other things where we did have some funding allocated. There's some points where working with IT, there's discussions whether it's going to end up being an IT line or if it's going to be individual budget lines. Unfortunately, I don't have a clear answer for you because we're still on that journey.
Hi, Marty Murphy from Ringling College of Art and Design. From your experience of all these unique applications, how many of these experiences could run on their own or without your presence or intervention in the room? Is that to the level of scale that you have right now?
I would love to say yes,
Okay.
but unfortunately, on the VR side, no. On the iOS side, or on the iOS, on the Mac or PC side, even though they work with VR, like in a synchronous environment, those experiences are deployed into all three environments. So when we deploy an application or a course, it'll get deployed in iOS, it'll get deployed in Android, it'll get deployed in Windows and Mac. So the ones that are, I would say iOS, or I shouldn't say smartphone, smart tablet, where people are more comfortable with the technology, does tend to be a little easier. And for the headset-specific ones, I would say that we don't need to be a one-on-one, but we do generally have somebody in the area for troubleshooting.
On that note, one of the benefits of you being there is that you can kind of witness the technological adaptation measurement of the room. The TAM measurement is a real thing. In your experience with these observations, like, what are some of the main detractors beyond like it being the nerd helmet? What else is an effect for people to adopt this technology?
Great question. The bane of my existence is that roller coaster experience, that horrible roller coaster VR experience where everybody walks in like, oh, VR makes me nauseous. I will say we've had hundreds of people go through and many of them expressing concern because they've gone through that experience. And we've been able to talk them through slowly, like having them go through and talk about the physiology that causes that and what we've done to kind of mitigate that, like trying to make it where if your brain only thinks you're moving if you are physically moving, to kind of mitigate some of those things, which has helped significantly. But through all that, like I said, we've had several hundreds, and we've only had one that they still finished the experience, but when they finished, they were a little lightheaded, and we had to get a chair and sit down with them for a minute. But overall, we were able to overcome that buy-in on the individual level.
For these rooms, in addition to the complexity of a small-scale room, do you have additional displays so that other spectators can see what's going on? I found that's helpful for easing people's tensions.
That's huge. So even when we're using the standalone headsets, sometimes it's nice to have if we have one of our Alienwares and we're, even if we're not offloading onto that, if we can stream to it, it's great. Also, if we're streaming to an iPad or something, just so people can see it, it is helpful. But also, it's important to have a tutorial. People know how they function in their clinical space. They don't necessarily know how they function in this world. So they have to know what button is going to allow them to move, what's going to allow them to grab, what's actionable. And they have to get a chance to practice it in a reasonable sense before you introduce the experience itself.
Hi there. As a fellow simulationist, how are you pre-briefing your learners for this type of modality? And also, I know different vendors, some of them have some debriefing built into their software. Most of them don't. How do you handle the debriefing and the pre-briefing?
Great question. So we're actually this has been a big discussion within our simulation team, and our current practice has been to utilize our standard ground rules that we would for a simulation, and same thing for the debriefing ground rules afterwards. Even if it's an asynchronous experience where everybody's finished but they might be at different times, we'll debrief that afterwards. The only caveats that I would say, we have done, particularly some of our 360 videos, where it's very intensive. So we have some behavioral health simulations where the patient is yelling and cursing and screaming at you, and it feels real. Like you get a little worked up. I would say we throw in the additional caveat that this is a safe place for those experiences, but if at any time you need to, you are welcome to get out of that headset, sit down, and go through, and we can find alternate curriculum to meet those needs.
How do you do the orientation to the devices with the learners?
So
How do you do the orientation to the devices? My experience has been they can be so distracted by the devices that they're not fully immersed in the experience.
No, that's a great question, and that's something that we've gone through several different renditions with. First, we'll do a just brief overview where myself or somebody else will go through and hold the controllers and just kind of talk through some of those pieces. And then we would put them we started with the manufacturers, the headset manufacturers, their tutorials. Honestly, it takes a lot for at least the ones I've used, and they're not all-inclusive. So we're actually working on developing one specific to the software platforms that we're utilizing, where they can go through and they can practice manipulating a piece of equipment, grabbing something, and moving around the room. All right, well, thank you all so much for attending the lecture. I really appreciate everybody's feedback.